Hi, I'm Dr. Shivika Gupta, consultant from Birla Fertility in IVF. Today, let's answer some of the most frequently asked questions from patients regarding IVF. The number one query that comes to us from patients is, how long does IVF procedure take? So roughly, I would say that IVF is a two-step procedure. The first step involves giving injections and making the eggs grow and ultimately forming embryos. Here, injections are given for 10 to 15 days where the eggs will grow, sperms will be taken, eggs are going to be taken through egg retrieval process, embryos will be made and they'll be frozen. This completes part 1 of the procedure. This is followed by part 2 of the procedure, that is transfer of these embryos. For this, we prepare the lining for 10-15 days and when the lining is ready, we transfer the embryos. So roughly, the whole procedure would take something around 2 to 3 months. Second question is, what are the side effects of IVF? In present day scenario, IVF is a relatively safe procedure. There are few injections that are given for 10 to 15 days. These injections are also safe, but you might experience some form of side effects, which could be physical side effects like headache, bloating, abdominal discomfort, constipation, and dehydration. This can be easily taken care of. Number 2, the side effect could be OHSs, that is Ovarian Hyperstimulation syndrome. This could be due to excessive hormonal stimulation of the ovaries, but this, due to vigilant monitoring and medical care, can be easily taken care of. Third would be multiple pregnancy. At times, IVF does increase the chances of having multiple pregnancy or twins or triplets. For some, it can be a blessing, but for some, it cannot be a welcoming thing. Another side effect would be the emotional aspect of IVF, because this does involve some kind of uncertainty. There could be stress and anxiety, but there are various methods to cope up with this and not consider it as a challenge. Apart from the said side effects, IVF does not impact the overall health or does not have any long-term side effects on the woman's health or fertility. Another important frequently asked question is, can I work full-time with IVF? And our answer to this is absolutely yes. You can work full-time and also undergo IVF without any hassle. For this, you would need a very supportive medical team who can manage your injections and your appointments for scans according to your schedule. Maybe on the day of egg retrieval and on the day of the transfer, you might have to take an off from work, but apart from that, you don't need to miss your work because of undergoing IVF. Is there an age limit for IVF? Yes, absolutely. According to the ART law that's been passed in India, the lower limit is 21 and the upper limit of age group for men is 55 years and for women it is 50 years. Less than 21 years we can't do IVF. For females above 50 we can't do IVF, and for men above 55 we can't do IVF. Another thing that patients very frequently ask is, what should I do if my first IVF fails? First of all, we should keep in mind that there is nothing like 100%. And if your first IVF has failed, don't get disheartened. Try to understand that why did your first cycle fail. We need to explore the options and the reasons. It could be because of poor quality of the egg or sperm, could be because of any chromosomal or genetic abnormality in the embryo, or it could be due to the bad receptivity of the endometrium. While we look out for the reasons, we should also try to find out ways, or that's something extra that we can do in the next cycle, because the cumulative success rate of subsequent cycles is always very high. Patients also ask us, should I freeze my embryos? This is a long debate between fresh embryo transfer and a frozen embryo transfer. But studies say that frozen embryo transfer has got a very high success rate. It gives the uterine environment some time to heal and come back to its original self after the egg pickup has been done. Secondly, it also gives us the opportunity to freeze all the embryos and also to select the best quality of the embryo for a transfer. It also gives us opportunities to do multiple transfer just in case if one embryo transfer fails. With present day technology, it has also enabled us to do genetic testing on the embryos. For instance, if families have some kind of a genetic disease running, or if there are multiple IVF failures or abortions, we can do genetic testing on these frozen embryos and only transfer the genetically normal embryos. There are so many times that we encounter that once we've done the egg pickup, we have embryos ready with us, but the lining is not ready. In such cases, if we freeze the embryos and then focus on maintaining or forming a good lining, we get very high success rates. Most importantly, that patients ask us that how can we cope up with IVF? IVF journey or getting pregnant, having a baby, this journey can be very overwhelming. It can be a roller coaster of your emotions. First of all, you need to acknowledge your problem and you should understand that what is the root cause of the problem and what is the solution to your problem. You need to educate yourself. For this, I would recommend that you should also do your research, try talking to friends and family, try going to a fertility specialist, try talking in support groups so that you know what actually are the options that are available for you. Number two, I would say that there should be a very open and good communication with your partner and with your fertility specialists. Only then you'll be able to make an informed decision. And the most important thing, that before you start anything, be prepared for what treatment you'll be undergoing and for any outcomes of that treatment. And while you're undergoing IVF, never stop taking care of yourself or your partner. So in this video, we've answered few of the FAQs. Stay tuned for another video where we'll be answering some of your more queries.
Book a free consultation today.